My guest, Anne Marie Foster, has been a leader in the healthcare industry for more than 28 years. She is currently the CEO of Phoenix House in New York. They help thousands of people overcome substance and alcohol abuse in order to lead healthy, productive, and rewarding lives. Say hello to Anne Marie. Hey everybody, Tanya Hart here. It's Hollywood Live. And my guest today has been in the business of helping people and in the wellness business for the last 28 years. I'm talking about Anne Marie Foster, who is president and CEO of Phoenix House in New York. She's joining me right here from New York in the Phoenix House. Hi, Anne Marie. How are you?
Hi, Tanya. How are you? Thank you for having me.
Oh, absolutely. I mean, you have been one of the people, you and your staff and everybody really have been on the front line there since this pandemic began. What has that been like for you? Because you're the place that people go when they have addiction, when they have other problems that need to be addressed immediately. How has this affected you?
Oh my goodness, it has been a whirlwind since March, and I am very thankful for my hospital experiences because being in a nonprofit like a residential drug and alcohol treatment, they don't necessarily have the same infrastructures that the hospitals have. But like you said, people who were here in treatment faced COVID, and we had to act quickly to respond to that. I mean, the numbers of cases that we had community spread, which was early in March. And we basically turned into like an urgent care center. If we could treat the individual and they did not require hospitalization, the hospital's like, don't send them to us. And so we ended up being able to care for them here at our facilities.
Well, good for you. And I know that's been a blessing to so many people. You know, at least now there's a little bit of hope on the horizon. There are vaccines that seem to be coming relatively soon. What is your opinion on that? And the other interesting thing that I'm finding, I honestly have not talked to a single Black person that said they were going to take this vaccine. Not one. And I know a lot of Black people. I know a lot of people, period. I'm just saying, right. I've not found one.
Right,
so
right.
What's your opinion on the vaccine and how this will perhaps help this situation?
Well, first I have to let you know that I am an executive, and so I'm not a clinician. And so this is definitely my opinion. I think it's important and it's necessary because what we're finding is that people are afraid to move and to leave their homes. And so people are not accessing care. They're not going to the hospitals unless it's a dire emergency. And we don't want that. While there's been an increase in like televisits, telemedicine, which is a good thing, you also have the issue that there are people who still don't know how to access it. So I think the vaccine will tremendously help and probably alleviate some of the pressures that individuals feel about going out and being around other individuals. I think for us, our concern is where do we fall in line to receive the vaccine? Will substance use and mental health programs be considered one of the top tiers or one of the ones that are essential, or like stigma in the past will get left behind? And so that's my fear as it relates to the vaccine. It's necessary, but I wonder when we will get it actually.
Well, I would think that because I mean, you have been, like I said, in the medical field for so long, even though you're an executive in the medical field, and ran one of the biggest Bellevue Hospital in the country, really, for mental health and for addiction and all of that. You don't consider that? You don't think that the government would consider you guys like really in that front tier?
The hope would be that they would, again, in this segment, in terms of nonprofits and dealing with individuals with addiction in a residential treatment. Again, hospitals, they're acute or they're there for short periods of time and then they're out into the community. There's some fragmentation where they don't necessarily see us as part of the continuum, as part of like that first tier, I would say. I think that's changing. I think, especially in New York, our governor has talked favorably about how you can have one system having and others not having. We need to be sure that all the individuals that are accessing care are receiving it and not one segment of the population. So I think with a lot of advocacy, being able to do interviews like this to talk about how important it is to make sure that nonprofits who treat individuals with mental health issues and addiction issues are treated exactly the same as anyone else that's in the healthcare business.
Well, absolutely, because if there's ever been a time when there's probably, have you seen more, or rather a rise in addiction? I know that there's been a rise in abuse, of children, of domestic abuse. And I'm sure addiction is the same way. I mean, when you're sitting at home all day and, if you've got a
Absolutely.
problem, it's going to get worse.
Absolutely. There's definitely been an increase in alcoholism. There's been an increase in use. The patients that we are receiving since we kind of reopened our doors, so to speak, are sicker. And because they're not also accessing their primary care services to check on their diabetes and their hypertension. And we know that individuals who suffer from addiction and mental health tend to die 25 years younger than the average population. And so it's because they're not caring for the primary care parts of their lives. And then the
Mhm.
addiction, of course, sometimes overtakes that. And so they're not getting the care that they need. So yes, this is the time we're going to see, what we're calling the mental health addiction wave follow COVID.
Mhm. Anne Marie, if you could get a Christmas present of the thing that you really want most for your particular field, and just for Phoenix House, but other places like you around the country, what would that Christmas present look like?
Oh my God, my list is quite long, I got to tell you. But if I had to narrow it down in terms of uh, where we are right now in COVID, and knowing what we know and what the data is showing us, is that we need to increase the access. We need to make sure that addiction treatment programs and mental health programs receive the ability to test their individuals, as well as if there is a vaccine, that the vaccine comes to us equally.
Mhm.
And I think we need to be ready to treat the whole patient, the whole person, and not just the addiction. I think our field definitely needs to embrace that they have to provide primary care services on site for these individuals. Because again, if your diabetes is out of whack, you have a heart condition, you're not focused on your addiction, you probably are using substances more to kind of cope with the fact that something else is going on with my body. And so we need to be seen as part of the continuum and caring for the entire patient. So those are about three things that would be on my list.
Yeah. Those are good things. They're all good things. How can people help you out over there at Phoenix House? Is there a way to contribute, or what can people do?
Absolutely, absolutely. And we rely heavily on fundraising and on donations. People, there's no one that is not afflicted with COVID and with the issue related to addiction and to mental health. And so if you go to our website, www.phoenixhouse.org, and you click on the New York site, you will be able to see all of the programs that we offer, and you'll be able to donate to us there, or you can call us at 718-222-6673 for more information about our programs.
And for people who are living in other parts of the country, I know, Phoenix House has been there for a very long time. You guys have really gotten that down. But for other people around the country who are probably watching this and maybe feeling like, I really need help, what should they do?
So the same website, Phoenix House has offices all across the country, in Texas and California, in the mid-Atlantic area. But I think another resource for people is SAMHSA, which is our federal government's program, the Substance Abuse Agency. And you can go on their website and find tons of information and resources that are available to you.
Well, Anne Marie, thank you for all that you've done for almost 30 years now. And you keep it going. And the good thing is that, at least in the mental health part of it, I do think that people are really opening up and feeling more comfortable about talking about it. So just, I'm going to give you the last word on that and what people should do about the whole mental health situation.
Everywhere I go, whenever I have an opportunity to talk to someone and we're talking about mental health, I tell people that if you had something wrong with your foot, you'd go to the podiatrist. If you had something wrong with your stomach and you're having stomach pains, you'll go to a gastroenterologist. And so if you have something going on in your brain or in your heart and you're suffering from depression, you would go and seek out mental health services. And it should be just that simple, that we need to be able to access care for whatever the issue that we're feeling without any stigma. And you just said something, shout out to all of those public officials or celebrities who are now talking about it and making people feel more comfortable about it. We need that. And I think our young people who are suffering as well too, they need to feel comfortable, like, well, hey, if Taraji P. Henson is talking about mental health, then it's got to be okay.
Exactly. And I love the fact that and Taraji's actually a neighbor. So, she's been at the forefront of this as well as many athletes and other folks.
Yes.
But you know what? We're all just following you because you've been doing this for a long time. And I think by this time next year, we'll all be celebrating you as well.
Absolutely. Thank you so much, Tanya. Have a good day.
Thank you for all you do. And we'll come back and talk after the first of the year and hopefully things will be
Yes,
better. Okay.
absolutely. Thank you. Take care
Okay.
now.
Thanks for joining us.